A mini stroke is when there is a temporary shortage of blood supply to an area of the brain. In this video, we look at if exercise is safe after the event. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'm going to provide exercise advice for anyone that has suffered a mini stroke. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. A transient ischemic attack, or TIA, also known as a mini stroke, can cause a series of short-term physical and cognitive impairments that can affect day-to-day activities. The term mini stroke implies that it's not a full-blown stroke or cerebral vascular accident, so in many cases the effects are temporary and don't leave any permanent changes. However, it's worth noting that a mini stroke can be a precursor to a full stroke, so if you think you've experienced one, you should seek medical attention straight away, even if your symptoms have subsided, as this can be a warning sign that you're at risk of a full stroke in the future. In the UK, we have the FAST campaign to help recognise someone having a stroke so we can act fast. F stands for face, so you can look to see if one side is dropping. A stands for arms, can they lift them both up equally or is one arm struggling? S stands for speech, are they having trouble speaking or finding it difficult to respond to your questions? And T stands for time, so time to call for the emergency medical services. Think of a mini stroke as angina of the brain, where the oxygen-rich blood is being temporarily restricted in one of the arteries to the brain. Depending on what area of the brain is being deprived of oxygen will dictate what symptoms you experience. For example, if the right side of the brain is being deprived of oxygen, then this can affect movement on the left side of the body. It's likely that the sudden onset of symptoms will last for a few minutes or hours, but then you'll fully recover within 24 hours. Following a mini stroke though, you will be left with a level of anxiety and will worry about what you can do to reduce the risk of experiencing a full stroke. The good news is that if you've been checked out by medical professionals, then they will be able to offer you details of what actually happened and what you can do going forward. In some cases, you may be placed on a form of medication to reduce the likelihood of a buildup of clots, such as a warfarin, aspirin or clopidogrel, and you'll be asked to maintain a healthy lifestyle such as a balanced diet, not smoking, limiting alcohol intake, and you should be encouraged to be more active. Physical activity, and in particular regular exercise, can reduce your risk of a stroke whilst bringing other benefits such as help maintaining a healthy weight, reducing cholesterol and blood pressure, two main risks for stroke, and improving your mental well-being. It wouldn't be advised to do any exercise that is of a high intensity, so as a guide, when exercising, use the rate of perceived exertion scale of 0 to 10. If you feel moderately puffed out when exercising, or between a 4 and 7 on this scale, then this is great and it will help you receive the benefits of the exercise. If you get really breathless, so up to an 8 or 9, then it's best to reduce the intensity so your blood pressure is not pushed up too high. Both cardiovascular or aerobic and resistance or strength type exercises are suitable following a mini stroke, and you can follow examples of some exercise routines I've done on this channel by checking out the playlist of follow along videos. I'll leave a link in the description below so you can take a look after this video. Likewise, if you're using a gym independently, then I would offer the same advice for exercise that I would for someone with high blood pressure. I've done a couple of videos on this now, so if you want more information on particular exercises, then again, I'll leave links in the description below. If you're left with some sort of mild impairment, then you may have to adapt some of the exercises you choose to do. This could be something such as reducing the time spent walking because your foot might begin to drop as you get tired. Or it may be that you don't quite have the grip strength on one side, making it difficult to sustain any kind of pulling or lifting exercise where the grip is under load. I will focus more on long-term impairments on how to exercise with them in next week's video for people who have experienced a full stroke and where function may be more limited. But if you have any questions, then please feel free to ask me in the comments section below. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.